Hi everyone, we're Team Skyscraper. Our problem space is healthcare system and language barrier. We aim to help visitors from all over the world get familiar with the process to see a doctor in Australia and help them find appropriate medical providers efficiently. The previous feedback shows we had our solutions first, then looked for problems to fit them. So this time we reorganized the structure and content in the background research. From this figure, we can see the total number of tourists is generally increasing these years. In 2019, Australia became the second most popular destination for studying overseas. So we can predict that more foreigners will travel to Australia in the future. However, the process to see a doctor is different in different countries. In Australia, people with mild symptoms usually visit general practitioners with appointments and call 000 for emergency. In the US, the types of doctors are classified too specific, so people may need to diagnose themselves first, then visit an appropriate doctor. In Germany, patients can directly make appointments with specialists. In Japan, South Korea, China, India, patients can directly go to a hospital without appointments. Also, the process to see a doctor may not be perfect in Australia. Sometimes it might be time consuming. The last part is the language issue. All temporary visas do not have strict requirements on English proficiency, so some people might not be able to communicate effectively. Furthermore, people who are not confident with English are less likely to receive medical services. However, translation implementations can also cause terrible problems because of the accuracy, so they have to be used with extreme cautions. Referring to the previous feedback, our stakeholders were too broad, so this time we only focus on non-residents or non-English speakers, including tourists, workers, and students who are currently in Australia and not familiar with the process to see a doctor.
Based on our more background research, we identify the problem more clearly now. Design and develop an application to be used on a mobile device that help patients who are non-resident or non-English speakers to get familiar with Australia's healthcare system and helps users get the treatment as soon as possible. Also, it provides medical term translation to break out the language barrier during seeing a doctor. For interaction paradigm, we change WIMP to mobile because mobile device can be connected to GPS that can determine the location to find the appropriate clinics. Now we use card-based methods in our key methods. And in the designed principle, we add accessibility, as we hope this application can be an option for stakeholders of all ages. We modify some requirements to suit research. The first one, we add the instruction function, provide instructions to get the process to see a doctor in Australia. As in our research, the process to see a doctor is different among countries. We change real-time translation to medical term translation to reduce the risk of translation errors. We make some changes on book appointments online in order to improve the efficiency of seeing a doctor. Based on existing system, we found that the waiting time is hard to be applied to medical online appointments, as actually it is hard to estimate how long a patient have to wait to see a doctor. Thus, we change this function to build available time to book the appointments. We just finished digital prototype and update it based on our conceptual model. After completing the conceptual model, we found that some questions that still need to be identified further. How to guarantee the personal information security and privacy by using email registration. How to keep stakeholders effectively understand the medical system in Australia, and the potential risks when patients use translation during medical treatments. This is our plan. In the following weeks, we will enrich background research, improve the engagement of stakeholders in system, interaction the conceptual model, and update the prototype. Also, we will focus on how to improve instruction effectively of medical service and do more evaluation of online booking. Thanks for watching.